Vaccination planning, recommendation and contraindication, post-vaccination reaction and complication, safe immunization. Vaccination is the creation of artificial immunity to certain disease. For this purpose, relatively harmless antigens, protein molecules are used, which is part of the microorganisms that cause disease. Microorganisms can be virus, such as measles, or bacteria. Vaccination is one best of ways to protect children from infection disease that cause serious illness. Before vaccination were available, vaccination simulates the immune system's response as if there are real infections. The immune system that fights the infection remembers the microorganism that caused it. At the same time, the microbe enters the body if effectively fights it. In our country, we have calendar of preventive vaccination, and we started our vaccination after birth. It means the first day. Indication for immunization. They are corresponding to the date of immunization according to the vaccine calendar. Unfavorable epidemiological situation. When a child applies to many medical institutions, his vaccination status should be assessed, and in the absence of contraindication, he should be sent for all age-appropriate vaccination. Temporary contraindication to immunization. First, moderate and severe somatic and infection disease immunization should be carried out 14 days after recovery. Acute respiratory infection and mild forms of diarrhea are not contraindication. Patients with chronic disease of heart, liver, kidneys, lungs, as well as patients with diabetes and other endocrine disease are subject to vaccination. Second, severe reaction to previous dose. Children with neurological disorders that are not vaccinated with vaccines containing the pertussis component only if there is an increasing dynamics of clinical manifestation. Children with stable neurological disease are subject to vaccination according to the calendar. Children diagnosed with perinatal encephalopathy should consult neurologists before the age of 2 months to rule out the progression of neurological disorders. Fourth, contraindication to the use of live viral vaccination. It means measles, mumps, polio, and influenza. Are congenital immunodeficiency condition. B, drug immunosuppression, and children with HIV infection. 5, children with allergic disease. In sick children with asthma, have fever, allergic dermatitis, and eczema vaccination with the expansion of the polio vaccination are carried out in remission if necessary against the background of antihistamines or in 1 day at hospital. 6, newborn babies, temporary contraindication to BCG and HBF vaccination is premature with mild weight. Children who have not been vaccinated in the first days after giving birth due to the disease should be vaccinated before being discharged from the unit pathology department. Newborns from mothers who activate tuberculosis are isolated from their mothers immediately after birth and BCG vaccination for a period of 2 months. For the organization and conduct of Ministry Health of the Republic of Uzbekistan and heads of the local medical and preventive services and responsible for vaccination in each medical institution where vaccination against infection disease are carried out by order of the head of institution. A responsible person for immunization must be appointed from among medical workers who have received special training in immunization and have a special certificate. By order of the chief physician of the institution, the management of the work of vaccination office is assigned to the deputy for child and maternity care in his absence to the head of the department. The room of the vaccination office should be wet cleaned 2 times a day using a separate marked cleaning equipment with the use of detergents and the end of the day with the use of disinfection. A general cleaning of the vaccination room is carried out once a week. Every medical professional who carries out vaccination is obliged to know the campaign for the organization and conduct preventive vaccination, follow the rules for handing vaccines, rules for safe immunization practice, safe infection in open bottle policy. Remember that measles, rubella, and mumps vaccines and the BCG vaccine should be used within 6 hours. Vaccines diluted and in use during this period should be destroyed, now as lipid, as well as with the introduction of tuberculin BCG vaccine. Before the vaccination, the nurse must check the available of doctor's opinion, pediatrician therapist's opinion on the state of health of the person who came for vaccination, as well as the absence of contraindication to the introduction to the vaccine. Wash your hands, check the name of the drug on the ampoule with the doctor's prescription, carry out the necessary procedures for the preparation of the drug according the instruction for the use. After vaccination, you should make an entry about the vaccination in the medical documentation indicating the name of the administered drug to the date of its administration, dose, and series. Inform the vaccinated person or his parents about possible reaction to the vaccine and pre-medical care for them. They need to seek medical help if a severe of unusual reaction occurs. Organize a visit the vaccinated person for the first 3 days after immunization. Post-vaccination reaction are clinical and laboratory changes that develop after the administration of a particular vaccine. For some live vaccines, the development of local reaction is a prerequisite for the formation of immunity. Post-vaccination reactions are ambiguous in their manifestations. Their severity can vary from mild to severe. Mild local reaction, temporary severe irritation at the infection site after administration. Post-vaccination complications are clinical disorders that differ in frequency, nature, and severe from post-vaccination reactions. Serious complications, especially with long-term consensions, are extremely rare. In order to identify post-vaccination complications, it is moderated that foster nurse actively visit the vaccinated person within 3 days after vaccination, and each such complication or suspicion must be registered with the mandatory submission of an emergency notification to the territorial polyclinic. The complication to register an emergency notification to submit it to the polyclinic include all cases lymphadenitis after administration of the BCG vaccine, all injection absence at the vaccine injection site, all these that in opinion of medical professional or the public were associated with vaccination within 1 month. All cases of hospitalization, severe of usual manifestations that the opinion of medical professional of the public were associated with vaccination within 1 month. All medical workers required of their professional and position are responsible for identifying and registering cases of PVR or PVO when people with PVR or PVO first contact them, as well as those who vaccinated and treat patients with PVR.